Okay, so we are ready to get started with our training today. This is a ship level 2 training with an emphasis on learning how to carry out plane comparisons, which will be part of the volunteer event in a few weeks. Again, I'm here. My name is Shay. I'm here with Christine and Rebecca. Um, Little note about the slides. So you should. So that is a tool that's available on Teams. Um,
Sorry, I don't know if it was just for me, but you like broke up, so we couldn't hear anything that you were just saying, and you just came back.
You froze for me
Great. Okay.
too when you were talking about how to use the slides.
Okay, great. So you should be able to at the top on the top bar flip between the different slides. So if you want to go back and check something that we just talked about, you can flip through the slides at your own pace. Here is our agenda today. So just a little bit of what to expect. And we'll move from here. We did introductions previously, so we'll move right into our volunteer program with Rebecca.
Thank you. I'm gonna take control here so I can move the slides. So I'm in charge of the volunteer program. So you will be hearing from me, along the way about different things and different opportunities we have going on. If you want to continue volunteering after these specific workshops, just let me know. I can put all of you on our, monthly list that I send out with activities that we have going on and updated information. If you're interested in that, just let me know. I don't like putting, all the students on there because sometimes you want to just participate in this specific event, and I don't want to just, spam you with lots of emails that you can't answer at this time. So if you would just let me know if you're interested in volunteering beyond the 2 plane comparison workshops, and then I will gladly add you to our email list. I usually send a monthly email with just things we have coming up, and I would love to have you all on there if you like to be part of it. Then so just to let you know a little bit about the level that you're being trained at today, it's called level 2 MIPA. It's a weird name, so just, don't get thrown by that. But it really just means you're getting some more in-depth training today and experience and understanding of Medicare, and you're specializing on plane comparisons with this training. So that will allow you to then attend community events and health fairs and give presentations on general Medicare or on the plane comparison topic. You can, of course, always give SHIP and SMP materials out and share general Medicare information. Even if you're not constantly active, you'll definitely want to encourage you to write down the SHIP hotline and just kind of let people know and point them our way, give us referrals so that we can help those people and kind of bring awareness to the SHIP program so that more people can benefit from it. You will also be able to learn, or we are learning this today, how to use the Plan Finder tool on Medicare.gov, and then how to do those plane comparisons and worksheets, and then also how to counsel people on the results that you're getting from your plane comparisons. So if you wanted to participate in some of our open enrollment events throughout the months of October and November, you could do that, and then do some of these plane comparisons with people in person, and then kind of present the results to them. And we'll go over how to do that today. If you're interested, you can also learn how to do lower income applications. That would be something you can learn. And then, of course, we want to always encourage everybody, as I said, to refer clients for counseling. So if you're not trained on a specific topic and people are asking you questions, you're always welcome to just give them the phone number and send them to one of us so we can help them with those questions. You all got the Tennessee SHIP SMP Volunteer Risk and Program Management Handbook in your package, and you'll sign the last slides there to let us know that you're agreeing with them. But I just wanted to point out a couple of things that are really important to just kind of remember. So any information that you give out on behalf of SHIP always has to be unbiased and free. So we will never tell anybody to pick a specific plan or make a specific choice. We just want to provide them the information so they can make an informed decision, but we cannot make a decision for them. People might try to trick you into that, but resist that and just give them the information. But they know their own history and health, and they know all the factors, so they need to make the decision on their own. You also need to make sure anytime you're talking to a beneficiary or as you're doing plan comparisons and looking at these worksheets, they will have, of course, their Medicare numbers on them. They might have a long list of prescription drugs they're taking on them. So we want to make sure we keep that information confidential. So if you are ending up to, working on anything from your home or, in a public place, always make sure you don't just leave out information. Make sure you log your computer again. And if you're finished with using the information, deleting it from your computer so that it doesn't end up in the wrong hands at some point. There may be some situations where, a client shared some information with you that you will then need to share with either somebody at Medicare office or with another SHIP staff member. And in that case, just always make sure that you get their permission to share the information. Because we do want to make sure that, we protect everybody's confidentiality and don't just, do something that the client might not be comfortable with. Conflict of interest was also another thing discussed in the handbook. And that really just means we always want to make sure we don't put ourselves in a situation where our personal benefit might be outweighing some of the decisions we will make as a volunteer with the SHIP program. So if you are, end up working for an insurance company, then, volunteering with the SHIP program would be a conflict of interest because you would be having to make decisions from work towards that specific plan. And so you wouldn't no longer be able to give them unbiased advice. Or if you have, a close family member who is involved with an insurance company, then that might be creating a conflict there for you because you might be leaning in that specific directions. And it's really important that we don't give out any biased information. And also another part of it is the information that we give out always needs to be free, so we can never accept any gift cards or larger gifts or anything like that from any of the clients that we have helped. Sometimes clients are really, really grateful for the help we've given them, and they might have saved a lot of money by switching them to another plan, and then really feel really happy and want to give you a big gift. And it has happened before. People have mailed like a gift card to one of our volunteers, but that's just something we are not allowed to take because of the grant funding for this program. So just, let people know that, and, tell them they can write a glorious recommendation letter for you, or, do recognize you another way, but we're just not allowed to take any gifts. Then this is important, and I think this might be on your test too, so pay attention. So for volunteer reporting, we always ask that everybody reports all their interactions on a monthly basis. The volunteer report for us happens either by logging your information in the STAR system, which is the system where we keep all the contacts and a record of everything that has happened with the SHIP program. And then all the training hours will also need to be logged on a monthly basis, so we can put them on our monthly report to the TCAD, who is monitoring the program. So ideally, we ask that you report your hours within a week of the contact, because that will help you to have still fresh in your memory what you talked about, so you can check the things correctly. Or at the very latest by the 5th day of the following month. We have to submit a monthly report, so it's important that we have all the information on there and everything can count. And it also helps us meet our performance measures. We have to, have lots of different categories that they measure for us and where they want us to reach out to specific people. And we have large numbers of people that we are supposed to reach out to. So it really helps, to count every single interaction that you have, even if it's just, a short conversation that is a referral for the program. That's something we can log as a contact in the system if you have given them just some general information on Medicare. So if you're able to do that, that would be great. You will all get a login for the STAR system later on, so we can do the plan comparison contacts in there. But that will be the same place where you could report regular contacts. And if you ever have any questions or you're not sure like what to put, you're always welcome to just reach out to one of us and just send, here's what I did, can you help me put it in there? And we're always happy to do that. For the level 2, we're doing these initial 4 hours of training. And then if you want to stay recertified, each year you just have to do 2 to 3 hours of update training, and then you can continue to keep your certification as long as you choose. So that's just due annually. You have to take the certification test each year and then provide those 2 hours of update training hours proof. And we have a great page on our website, gnrc.org/SHIP volunteer resources. That's a great thing to bookmark if you ever have any questions. You want to remember like where to log your hours. You are trying to find a link to a training, or you're trying to find the link to get 2 stars to enter your contacts. We have like a list of links on the left-hand side, so you can find all of them, and a good summary of all the different things that are going on and the different websites that you can use to find information. And then also you all have signed up in the volunteer portal already. So that will be the place where you would log your training hours, or you can sign up for any of the opportunities that we have going on. So people always get a little confused as to like where to report what. And so I've made this little table, what to report in the volunteer portal and what goes into stars. So any training hours we record just in the volunteer portal. So if you're doing update training on your own, there's monthly webinars and different things that you can do to kind of expand your knowledge. And once you've completed this training, you're welcome to, attend any of those. And usually they are also recorded. So if the time that live session happens is not good for you, you can always watch the recording later and kind of just, stay in the know and learn more about different topics around Medicare that interest you. TCAT now also has a new training system. And if you're interested in learning more, I can enroll you into that. And there's, a library of different resources in there that you can watch and go through and just learn more and level up if you want to. Then any time you spend on doing any administrative work, so if you're helping us with data entry, for maybe another counselor, or from a mailing, if you're wanting to do help us, stuffing envelopes, entering data, any like those administrative things, or even social media stuff, that would fall under administrative work, and so would be just entered in the volunteer portal. If you are attending any events for us, or going to any of the enrollment events, you can always include your travel time to the event site into your hours for that day. And you will also be able to log any events and fairs and presentations in the volunteer portal as well. And then in STARS in itself, you're just putting in the direct counseling contacts that you've had, or if you're doing, a plan comparison or research for somebody, that would also be counted as a contact in STARS. And if you're, doing a bunch of research or you're spending a lot of time and doing the plan comparison, you can put all the time you spent in that contact, not just the, 5 minutes that you might be talking to the client, but also the 40 minutes that you spend on doing the plan comparison, for example. And you just add all of that up and put it under the same contact. And if you're doing events and you're talking to somebody directly and spending some time with them talking, that would also be then logged as a separate contact in STARS. Then just want to quickly show you how to add time in the volunteer portal. And I just did some screenshots because I figured you guys are all probably can do this easily and it'll not be a big deal. But if anybody has questions after this or has issues logging anything, feel free to reach out and I can walk you through it. So once you logged in, and I just stole Sammy's profile here, you just, you have this screen after you log in, and you should see the add hours up top, and you should also have in that list here a track my schedule to track my hours, and you can click on either one of those and it'll take you to this hour entry form. It's important that you have responded to an opportunity before you enter hours for it, because otherwise it will not show up here in the drop-down list. So if you were going to add the hours after this training, you should have in the drop-down list here, that there was the Medicare training today, and then you can click on that and then just put the date. So today will be 10/2, and you will put the hours. It's a 4-hour training, and then you can put something in the description, which is always helpful to me if you just put a couple short words in there what it was. For this training, it would already say in the title of the opportunity that it's a specific training, but if it's something else where I don't necessarily have talked to you beforehand, it helps me to just know if you did what you did exactly, because I have to spell that out on our monthly report. And then you just, if you have done like a webinar and you got a certificate for it, you can upload that here. Or if you didn't get a certificate, you can just use that webinar confirmation email and just upload that here as well. And then you just hit submit hours and it'll come to me for approval. And here's just wanted to show you what it looks like if you click on your opportunity responses. So here you can see all the opportunities that you currently have responded to. So you can also go right here, and if you click on the options here, you should be able to add hours there right away to, or change your response or something like that. Okay, that was kind of my portion. If you have any other questions on, how to continue volunteering or anything like that, you're always welcome to just reach out to me. I'm usually easiest to reach via email because I check that pretty frequently. But you can also give me a call if you prefer that. And then I'm gonna, yeah, you all have the information for the workshops, and we will send you instructions on exactly how to get to their classroom. For those that are not, studying at Lipscomb and might not know their way around as well. And I will send that to you once I have that information. Now, I'll let Christine take the screen.
Thank you so much, Rebecca. So Rebecca is being very modest about her promotion. She's gone up a rank. So yay! Everybody clap for Rebecca, because for one thing, she well deserves it. And for another, that'll get you moving a bit. I see there's a question. Go ahead and unmute yourself and ask.
I thought that was going to be something where I could like clap, but it's not. I don't know how to use Microsoft Teams very well.
Oh, okay. Yeah, there is the little one with the hand up. Doesn't it give you the option to clap? There we go. I'm seeing it clapping down there. Yeah. So you just have to choose the right one. So if it looks like this, then that's putting your hand up. If it looks like this, then that's clapping. So yeah, yay for the ritual clapping. But you can really clap since you're muted anyway. Lily, is that putting hand up or is that clapping? Okay, I'm going to assume it was clapping. So yay, Rebecca, thank you so much.
Thank
As
you.
as Rebecca says, your efforts count towards our what are called performance measures. So that's how they tell whether or not SHIP is doing a good job in reaching Medicare beneficiaries. And that's very important because they have to prove this because they're using taxpayer funding. So you're a vital part of not only helping Medicare beneficiaries now, but making sure that Medicare beneficiaries get help in the future. Because if we can't show that we've been helping people, then they're not going to fund the program anymore, and those people won't get help. And it sounds like all of you have experienced people needing that help. As Rebecca also said, she does a monthly report. And so in a way, and this hint is because of the testing, in a way, you too are doing a monthly report of your time, even though you may be doing that monthly report a bit at a time, like you'll be putting into stars what you just did today, and you may not do anything at the end of the month. So what is SHIP and why should it continue? Why is it important? It's important because this is the only source for free and unbiased Medicare counseling. There are a lot of agents out there who are saying, we have your best interest at heart and we're going to get you the best plan. And that may or may not be true. They may get the person the best plan, but for sure what they're going to do is they're going to get them the plan that will give them the most money. So that gives them a conflict of interest right off the bat. A lot of them may only work for one company, so they're only going to see Aetna plans. So they may find them the best Aetna plan, but maybe the best plan for them is a Blue Cross plan. So we are the ones that actually give them the information about everything that's out there, and we don't charge anything for it, and we don't try to push them into anything. It can be very difficult. I mean, I've been doing this for a while, and yet I still run into what Rebecca was talking about, people wanting you to decide for them. And all you can do is just give them the information, try to make it as accessible as possible. So a counseling tip, one thing to do is to say, we've given you the 3 plans with the lowest prices. There are other considerations other than price, so we can't tell you which one to pick. That is up to you. But from what you've told us, this covers your medications, and any of these plans should work for you, but it's up to you what you want to pick. I did this week have a very humbling experience where I had spent a lot of time with a client, and then she chose to go with an insurance agent because they would tell her what to pick. She kept asking what to pick, and I kept on explaining that I couldn't tell her, whereas an insurance agent is always going to be happy to tell them. So SHIP, which is a little bit awkward to say sometimes, I'm with the SHIP program. I usually say I'm with the SHIP Medicare Counseling Program. It stands for State Health Insurance Assistance Program. And in Tennessee, we use that name. It's the name used nationally as well. But in different states, it may go under a different name. So everybody has them. They're in all 50 states, but they may be called something else. They're also in the territories and they're in the District of Columbia. So everybody who's getting Medicare should be able to get it, but it may be called Shine or HICAP or something else. But nationally, it's called SHIP, and you can always find your local SHIP program at shiptacenter.org, I think. I'm going to ask Shay to double check that if she's listening. SHIP provides a much needed tool. People get very confused with Medicare. It's very important, as I was mentioning earlier, to remember that SHIP services are funded through federal grants from the Administration on Community Living. So the SHIP program is run by the Administration on Community Living. And we are going to be throwing a lot of acronyms at you, which probably is nothing new for most of you. SHIP has 9 regional offices in Tennessee. So Tennessee SHIP, and we are, of course, the Middle Tennessee one, but because we're part of the Greater Nashville Regional Council, that's our name. Greater Nashville Regional Council, Area of Agency of Aging and Disability, Tennessee State Health Insurance Assistance Program. And now I want you all to mother that to yourself 10 times fast. Who do we help at SHIP? SHIP can help almost everybody. As I was saying before, we are here to give Medicare information, and people may think that they don't need Medicare information, but they probably do. There's probably some older person in their lives who may be struggling because they don't have this kind of Medicare information and needs SHIP services. So we help seniors, anybody with disabilities. We'll talk about how if you've been on disability for 24 months through the Social Security Disability Insurance Program, you're entitled to Medicare. People with certain diseases like end-stage renal disease or ALS are also entitled to Medicare. Caregivers, community advocates, family members, and of course, a lot of you are members of a very big group that is asked for Medicare information all the time, which is health professionals, and we don't even have that on our little chart, but absolutely. What is Medicare itself? What is this program that we are helping with? It's an insurance program. It's a health insurance program that was specifically originally made for people who are 65 or older, and now includes people who are under age 65 with certain disabilities, and people who have end-stage renal disease, that can be any age with Lou Gehrig's disease, ALS. And it's important to know that Medicare is administered by the Centers for Medicare and Medicaid Services, and that's cms.gov. You can go to that website and find out more about the Centers for Medicare and Medicaid Services. I don't want to overwhelm you with resources, but be aware that there are a lot of great resources out there. And if there's anything that's confusing you, chances are there's a really good resource out there that can give you more information than you will ever need. Medicare falls roughly into 4 parts. Original Medicare is A and B, and it's very important to know what the different parts of Medicare are, because this is one of the things that can really, really confuse a Medicare beneficiary or their loved ones or anybody who's trying to start coming to grips with Medicare. The first part is Part A, hospital insurance. Hospital insurance can cover a few things. Mainly, it's covering inpatient medical care, and we'll talk more about that. But if you're in the hospital and you're an inpatient and you have Medicare, you're being covered under Part A. Also covers hospice and skilled nursing care. Part B is almost the everything else medical. Part B covers all of the other medical situations like physical therapy, going to the primary care physician, and we will talk more about that later as well. Medicare Advantage bundles together the 3 main parts of Medicare. So it bundles together the hospital part, the medical provider part, and usually the prescription drug part. The prescription drug part is Part D, and that is the part that provides prescription drug coverage. Now, A and B are called Original Medicare, partly because when you get your Medicare card, that's what you're going to see on it. You're going to see A and B. And those are the programs that are covered by the federal government entirely. Part C and Part D are regulated by the federal government, but they're actually private insurance companies, private healthcare companies. So because of all these different parts, there are different ways to get your Medicare. If you choose to stay with A and B, with having your original Medicare from the federal government, you then can add Part D, most people are going to want to have some sort of prescription drug coverage. And you can also add, and this is also regulated by the government, but is more just a straight insurance policy, a Medicare supplement insurance. This is called Medigap or Medicare supplement insurance. And again, we're going to talk more about all of these things, so don't feel like you have to understand them yet. But this is just letting you know the two different roads to go down. The other road you can go down with your Medicare is to go with one of these Medicare Advantage plans. The Medicare Advantage plans, sometimes called Part C, are HMOs or PPOs. They're these health maintenance organizations or these private provider organizations that are networks of medical providers that are organized by a health insurance company and that you can enroll into and have everything basically with this one plan. Underneath, you still have Medicare. You can always go back to original Medicare each fall during the annual enrollment period. So it's very important if you are talking with a Medicare beneficiary to make sure that they understand that they do still have original Medicare underneath it all, because some Medicare Advantage plans, in an attempt to keep them on the Medicare Advantage plan forever, will make it seem like they should get rid of their Medicare card, which of course they should never do. And I think, Shay, did you want to take over for the enrollment period?
Sure, I can do that. So looks like we're getting a little bit of an echo. Okay, so when you are enrolling in Medicare, there are different windows of time when you can enroll. And the windows in time are really important in Medicare because if you don't enroll when you're supposed to in a window when you're supposed to, you can have a penalty. And some of those penalties can last the whole time that you're on Medicare. We'll talk more about that later, but that's just why we emphasize the timing so much in enrollment. So the first time that you're going to be eligible for Medicare is the initial enrollment period. One of the main ways that you can be eligible for Medicare is by age, by turning 65. So during that period, you have a 7-month window where you can enroll in Part A and or Part B without those late penalties. And that is 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. It's important to be aware that if you enroll after you turn 65, then your coverage will be delayed until after that. So if you're wanting it to start right when you turn 65, you want to be able to enroll before you turn 65 in the months before. But in general, to avoid the penalty, it's that 7-month window. So there are different parts of Medicare, as Christine already mentioned. We're going to briefly go through those different parts, and then we'll have more opportunities to talk about it later. So Medicare Part A, that is hospital coverage. So that is inpatient hospital stays, skilled nursing care after an inpatient stay, hospice, blood transfusions that are happening at hospital. It's important to know that if you are at the hospital, but you are not admitted, so you're not admitted as inpatient, it's observation, it's not an admittance, then it does not count under Part A, and it would actually be covered under Part B, which we'll talk about in a moment. But Part A is only when you are considered inpatient at the hospital. Part A and Part B are both enrolled through the Social Security Administration. So Part B, that is medical coverage. So this is primary care services, specialist, doctor's office. So anything that's considered outpatient would be in that Part B coverage. This could be surgical services or supplies, testing, outpatient therapy and mental health services, anything preventative like screenings or shots or annual checkups. That's all considered to be outpatient. And so that would be Part B covered. And again, these are both enrolled through the Social Security Administration. I'm going to pass it over to Christine to see if she wants to add anything, and then we'll go on to Part D, which is our drug coverage.
I just want to emphasize the enrollment through the Social Security Administration. And the reason for that is because I have only lately become aware of how little people know about that. So if you talk to the average person who has not yet reached Medicare enrollment age, or even the person who is turning 65 and wants to be on Medicare, they don't realize that they have to enroll through Social Security. They think that it's something that they do through Medicare, which would make sense, except because the whole program is basically Social Security collects the money. That's why it's done that way. And originally, it was fairly seamless because most people were getting their Social Security benefits at age 65. And so when they were getting those benefits, they were going ahead and getting their Medicare at the same time without even having to think about it. Because if you're already collecting your Social Security benefits, they enroll you. But if you're not, they don't. And most people now are not going to be reaching the age to get their Social Security benefits at age 65. So most of them aren't taking them early and they don't realize they have to go to Social Security. So that's a bit of a digression, but I feel like it's an important one just because I've been encountering so many people who need to know that.
Okay, thank you for that emphasis. So the next thing that we're going to talk about is Part D. And that is the part that we're going to be talking about a lot in our plan comparisons, because that is the part that we are doing plan comparisons for during this open enrollment period, which we'll talk more about. So Part D, D as in drug. So this is the prescription drug coverage. Part D, no matter what way you go, will be administered by private companies that are approved by Medicare. And so that's why we do these plan comparisons, is to compare what the different options are. There are two ways to have drug coverage. There are the PDPs, which are standalone Part D plans. Those are aligned with original Medicare. And then there's Advantage plans that include drug coverage. When you have a PDP, in order to enroll, you must have either Part A or Part B and live in the plan's service area. So sometimes we have people call in who are moving from one state to another or a different area to another. They will need to enroll in a new Part D plan in their new service area. Even if they go with the same company, you still have to enroll in a plan in that geographic service area. And with those Advantage plans, you have to be enrolled in Parts A and B to get an Advantage plan. And that's because those Advantage plans are bundled together. And so they include Part A and Part B in the same plan. Also have to live in the plan's service area. For all of these Part D plans, you cannot be outside of the United States or incarcerated and must be enrolled in a plan to get coverage. One piece of information that we add when we talk about Part D, and we will talk about this more when we do the plan comparisons later on this morning, is something called the coverage gap. So this is a period of time when the cost structure for the drugs change. And before the coverage gap, the cost structure of the drugs might be based off of what tier the drug is in. The coverage gap is a period of time where it's after the beneficiary and the plan have paid a certain amount of money into the plan overall, and you reach this period called the coverage gap. The cost structure for the drug changes, and it becomes a percentage of the retail cost. So depending on what the original retail cost of the drug was, it may be more expensive in the coverage gap, or it may be less expensive in the coverage gap, depending on what that original retail cost is. We'll see a lot of examples of this when we go through our plan comparison training. This is just an introduction to that concept. This recently was changed in the last few years to where now when you enter the coverage gap, it used to be called the donut hole. Now when you enter the coverage gap, it can be no more than 25% of the retail cost. So that's a recent change that has happened. We're just going to pause really quickly because we have gone through a lot of information already and just wanted to see if there's any questions. You can either type your questions into the chat, you can use the raise hand feature, or you can just come off mute and share your question, whatever you prefer. So we'll take a few minutes for any questions. Great. So yeah, coverage gap pricing. Yes, we'll talk a lot more about what that change meant for the costs and what that change means for the cost when we look at some costs. But yes, that change was significant recently.
Yeah, that was part of the Affordable Care Act, and it was gradually phased out over the past years, so past 5 years or so, whenever the Affordable Care Act came in. So Medicare does change over time, and that's something to be aware of. There aren't any huge changes currently, but there are some things that could happen. So we're always looking at that. And remember, you do have a test today. It is multiple choice. It is open book. Is Part B the only part of Medicare associated with Social Security number? So if you're using SSN for Social Security number, none of them are any longer associated with your Social Security number. They're still both Part A and Part B. You do get into Medicare, both Part A and Part B, through Social Security. So you do apply and enroll through Social Security Administration. It used to be when you applied and enrolled through the Social Security Administration, when you got your Medicare number, it was your Social Security number usually, or your spouse's Social Security number, or your parents' Social Security number with a little letter at the end. That is no longer the case. I think we have a slide on that. Is that one included in today's presentation, Shay? Yeah, okay. So yes, so we'll have a slide on that a little later. What drives changes in the cost structure of drugs? That's a really good question, Lily. And I don't have a wonderful answer for it. My answer is basically that they negotiate every year. So things come in. There's been a lot of pressure lately for Medicare to actually try to negotiate with drug companies. They don't. Medicare basically works things out with the insurance companies, not the drug companies. So the cost structure that's decided on, and they have made some changes in that recently, is decided on between Medicare and the insurance companies. Is there anything else? Is there any confusion between the different parts? Is there any confusion between the different parts of Medicare? Because that is the main thing that we just covered and the main thing you're going to be tested on. Okay, seems not. Medicare Advantage, or Part C, to go in depth on this one, It combines these different parts of Medicare in packages that are run by private insurance. So when you switch from original Medicare, or when you enroll in a Medicare Advantage plan, you are going into a system that's covered by a company like Blue Cross or Aetna or United Healthcare. And they are designed for relatively healthy people who are willing to pay copays when they have a hospital visit or they have a procedure done. They often have lower monthly premiums. So frequently people who are going with a Medicare Advantage plan don't have to pay anything beyond their Part B premium. Part A, for most people, it's important to know, is premium free. Most people are not going to have to pay a Part A premium because they've worked long enough. So if you're going with a Medicare Advantage plan and it's covering the drugs and it's covering the hospital and your medical, you're still paying your Part B premium, but you may not have to pay anything else. This year, the Part B premium is $148.50. These are network plans, so they're HMO or PPO plans, as I talked about before. You are going to have to stay within the network. If you have a PPO plan, you can go outside the network, but you're going to have to pay a lot more for doing that. You're going to have a copay for services. They may offer some extra benefits. Medicare currently doesn't offer dental, vision, or hearing. So people who want that may decide that they want to go with a Medicare Advantage plan, which offers some coverage for those. That's something where you have to be very careful because it does differ by plan. They don't travel well. Remember that these are regional plans, that if you go to a different region, you are going to have to enroll in a different plan. So that even means that if you're spending a couple of months elsewhere in the country and you have a routine medical issue, you're not going to be able to get it covered through your Medicare Advantage plan, most likely. If you have an emergency situation, yes, if you're out of the area. But if it's just something that, like, you have to visit a therapist every 3 months, or you need to go in and see somebody in order to get a prescription refilled, that's something where they're going to expect you to stay where you already are and see your normal people. The Medigap plans are something that go along with original Medicare. So if you don't like the idea of staying within a network of providers, if you want the flexibility of seeing whoever you want to see who takes Medicare, they still have to take Medicare, then you may be interested in staying with original Medicare, but you may be concerned about the high copays. There's a Part A deductible for Medicare. There's also a Part B deductible, and there are copays of 20% after you've reached your deductible for Part B. So this is something that people go into and get because they don't want to have uncertainty. They want to know that they're going to be covered when they go to see their doctor or if they have to have a hospital stay. So it's a supplemental insurance. It's offered by private insurance companies like Medicare Advantage plans or Part D plans. It's private companies that are regulated by the government, but they're not run by the government. It covers these different parts of Medicare: coinsurance, copays, the Part A deductible. If you started Medicare before January 2020, you can also get the Part B deductible covered, but the plans that cover that were discontinued as of January 1st, 2020. This is only if you stay with original Medicare. It's very important to know that you cannot have both a Medicare Advantage plan and a Medigap, and that Medicare Advantage plans mean you're not on original Medicare at this time. If you are on original Medicare, you can get a Medigap. If you're not, you cannot. So Medigaps, because they're an insurance policy, would ordinarily be subject to medical underwriting. And that means that they can take a look at your medical history, find out, do you have a chronic condition? Have you been hospitalized? And they can charge you higher premiums or deny coverage to you. So that's true of Medigap plans. But in exchange for letting all of these insurance companies have access to this highly lucrative group of people to insure, Medicare carved out an exception. So people who are starting on Medicare have a guaranteed issue right, or a Medigap enrollment period, which means that during the first 6 months, starting when they get Part B and are 65, there is no medical underwriting. This is very important for people who are initially getting their Medicare to know. It's not so important today, except for testing purposes, because most of you are starting out at least with doing plan comparisons, and that's normally not going to be an issue for doing plan comparisons. But it is important in general to realize that there's just this 6-month window. That doesn't mean that they won't be able to get it in the future, but it does mean that an insurance company can turn them down for any reason or for no reason in the future. They can turn them down because they're 65 and a half if they want to, so it's just their period of most choice is that first 6 months. And I'm going to turn it back over to Shay to talk about some of the programs.
Okay, so next we're going to talk about some of the help programs that help with some of the costs of Medicare for those that are eligible. So the first program is called Low Income Subsidy, LIS, or Extra Help. This is a program specifically for Part D prescription drug costs. So this program helps low-income individuals receive help with their drug costs. It is administered through Social Security. So the application process is through the Social Security Administration. There are different levels of extra help. There is partial extra help and full extra help, depending on income eligibility within the eligibility. But full extra help pays for the Part D plan premiums, deductibles, and then lowers the co-pays for the different drugs. On the left of the screen, you'll see the current eligibility guidelines. It is broken up into income and assets, and it is different for a single person and a married couple. And these numbers do change every year. We'll get the new guidelines in usually about February. And so you can always find our most updated numbers at gnrc.org/Medicare. We'll always have the most updated numbers up there. And these eligibility numbers are based on percentage of the federal poverty level, which is why the numbers change every year, because we get a new designation of what the federal poverty level is for that year. So with assets, that can be a variety of additional assets that somebody has, but sometimes it can be like an additional property. So the house that you live in would not be considered an asset because that is where you live, but any additional property or additional homes, that can be an asset. But there is a wide list of what can be considered those extra assets. This is also one of those things where we're giving you a basic level of this information now for the purposes of this training. If you were to want to continue to volunteer with SHIP and continue to do Medicare counseling and increase to a level 3 of a volunteer, we would go more in detail as to the eligibility and the requirements and the application process. But just for today, knowing that this is the eligibility. When we do the plan comparisons, if you are logged in on a beneficiary's account, it will tell you if they have LIS, and so the LIS will automatically be applied to the drug costs that will show up in the comparison. So if somebody has LIS, it will show up there and you'll be able to see what the costs are. So Medicare Savings Program is the other help program. This is also known as MSP is the abbreviation. And while LIS and Extra Help is through the Social Security Administration, Medicare Savings Program is through TennCare. So that's through our state program. And this helps pay premiums, deductibles, and coinsurance for other parts of Medicare. So specifically, these programs cover the Part B premium. So all 3 of these programs cover the Part B premium. On the far left, you see qualified Medicare beneficiary, and that is the program that gives the most help. And so this program covers premiums for Part B, deductibles, and coinsurances. You can see the income levels that qualify for that on the screen. And SLMB, which stands for Special Low Income Medicare Beneficiary, that is the next level of MSP. This is a program that just covers the Part B premium. So while QMB may cover coinsurance, this would just cover the Part B premium. And you can see it's the middle income level of eligibility as well. And then QI1 is qualified individual. This is also a program that covers the Part B premium. It's a little bit different than SLMB because it's grant funded. So in theory, there's a limited number of QI1s that can be granted in a given year. However, we have not seen in our experience in our job so far a situation where it hasn't been granted, but because it's through grant, it is limited versus SLMB. Anyone who qualifies would get that Part B premium through the Medicare Savings Plan covered. Again, these numbers will be updated, and so our most up-to-date version of this information will always be at gnrc.org/Medicare. And again, this is something where this is the basic level of information for this program, but if you were to volunteer further, we could go into more detail about what this looks like. Okay, so we reached another pause to see if there are any questions about what we've covered. Great question. So if a beneficiary wants to keep their current plan, like a current Part D plan, and they don't want to change, they can just keep that plan and will automatically continue on until the next year if nothing is done during the open enrollment period. If there is a change made, then that would take effect January 1 of the next year.
Yeah, that's an excellent question. There are some cases where they may not have that ability. Sometimes plans do go away, but they will receive in the fall an annual notice of change from whatever plan they are on. And that will let them know, for instance, if a drug that they're on is no longer going to be covered, or if there's going to be a premium increase. And they often will make their decision based on that information. But as Shay says, absolutely, if it's going to be still there, they can just keep it and not do anything.
And that's a great question. So for context of what we're going to be doing ultimately with our plan comparisons is we send out letters and worksheets to all of the beneficiaries that we've talked to recently. And we get those back where people fill in their information, and that's where we do the plan comparison from, is from these worksheets. And so one of the questions on the worksheet is, are you interested in making a change? Because some people might just want to see what's out there and then make a decision, but we'll start to get these worksheets back and we'll run these comparisons, and then the beneficiary would make a choice whether they want to keep their current plan or make a change. Okay, great. We will move forward, but again, if you have any questions, feel free to just type them in the chat while we're presenting. So I will pass it back over to Christine to talk more about our enrollment periods.
There are specific times when you can get your Medicare, and we've talked about the initial enrollment period. This 7-month period is really very important, and it's important to know that there's just a little sort of oddity about it. If you happen to be born on the first day of the month, say you were born November 1st, instead of your Medicare starting November 1st, your Medicare would actually start October 1st. You still need to sign up for it, of course, so you would need to sign up for it in September instead of being able to wait until October as you normally would. So for most people, it's going to be the first day of the month of their birthday. For me, that would be July 1st. I would start my Medicare. But had I happened to have been born on July 1st, then it would have been June 1st that I would start my Medicare. So in that 7-month enrollment period, adjust accordingly. It's 4 months before your birthday month if you were born on the first day, as opposed to the usual 3 months before your birthday month. General enrollment is even odder. General enrollment is for those people mostly who did not enroll when they were supposed to. And if you didn't enroll during initial enrollment and you don't have a special enrollment period, that's not something we're going to go into too much today, but it is important to know that there are circumstances under which you can enroll in your Part B, for instance, later on, or your Part A later on. But if you didn't do it, if you just made a mistake, then currently the way the general enrollment period works is there's only one time a year. You can only do it the first 3 months of the year. And even more frustrating for many people, your coverage does not begin after you've enrolled. Your coverage will not begin until July 1st. So it's important to know that right now, the way general enrollment works is you start off at the beginning of the year and through March 31st, you have that opportunity. But say you only realize in April that you never enrolled in Medicare and gee, you meant to, and you missed your initial enrollment period, you've now also missed general enrollment. And that means you have a very long wait because you will have to wait until next year, and then it won't begin until July 1st. Your open enrollment period is what we're mainly here today about. So this is when all of the Medicare beneficiaries come out to play. They all get to get in the pool if they want to. Now, they don't have to. And Lily's very good question. Lily, that was a great question. Made that clear. But not everybody has to jump in to open enrollment if they want to. To do so, they can. If they don't want to, that's fine too. So October 15th, we're in the run-up period right now to December 7th. This is the time of year when everybody can change what they have. This is usually used to change your Part D or your Medicare Advantage plans. You may ask about what your Medigap plans can do during this period. Theoretically, you could go ahead and change your Medigap plans, but you have to find somebody who's going to sell you one. If you already have a Medigap plan, you can keep it forever so long as you keep paying your premiums for it. But if you don't have a Medigap plan, you do run into that medical underwriting and you may not be able to enroll. So if you do make a change in your Part D or your Medicare Advantage plan, that is going to be effective, as Shay mentioned earlier. It's going to take place January 1st. That's when you start your new plan with your new year. It's very important for Medicare beneficiaries to know that there are penalties built into this system. This is probably the saddest situations that we encounter, are the ones where people did not realize that they were setting themselves up for having a permanent penalty that they are now going to have to pay forever because they didn't sign up for something when they were eligible. The ones to know about, Part A and Part B. If you do not sign up for them when you are eligible, and that is you don't have other creditable coverage and you just basically have not signed up, then you have a temporary 10% penalty fee for your Part A, and that's for double the years eligible and did not enroll. But for Part B, the penalty is permanent. You're going to have a 10% penalty from here on out for every year that you were eligible for it and did not enroll. And you may ask, percentage of what? And that's of the premium. And the premium goes up, so your penalty goes up. Similarly, with Part D, you have a permanent 1% penalty for every month you were eligible and did not enroll. And that's going to be a very, very much smaller penalty because not only is it 1%, but also the premiums for Part D plans are much smaller. But still, if you had many months where you were eligible and did not enroll, that's going to be a lot. It's very important to remember, as we talked about earlier, that the new Medicare number is not a Social Security number. Older beneficiaries may be confused by this. I was talking to someone the other day that thought that the new Medicare number was actually a coded version of their Social Security number, and that people could somehow get to their Social Security number through their Medicare number. You can't. They have no relationship to each other anymore. That is a good thing. It means that if there's fraud or some sort of problem, they can get a new Medicare number. So it's not the same thing anymore. That is something to be aware of when looking at plan comparisons. If you see a Social Security number, if you see a string of numbers, instead of seeing a bunch of numbers and letters mixed in together, then you know that most likely they put down the wrong number. So that's a very good thing to highlight in today's training. Senior Medicare Patrol. Shay, did you want to take over on that one?
Yeah, so the
Okay.
Senior Medicare Patrol is connected very closely to the work that we do at SHIP. It also is called SMP, and it is a program to empower seniors to prevent healthcare fraud. And so it focuses on education and outreach, and they have a 3-word slogan that they use to describe what they do, and that is prevent, detect, and report. So the first thing is prevent. And so SMP says to prevent by protecting. And so we mentioned this earlier, but we will tell beneficiaries to treat your Medicare card and number like you would a credit card. On the right of the screen, you will see the Medicare card that beneficiaries will receive. It's sometimes referred to as the red, white, and blue card. You'll see that it has their name, their Medicare number, and then when they started Part A and Part B. We're going to talk about this a little bit when we get to our plan comparison training, but if a beneficiary would like us to create an account for them on Medicare.gov, we'll need to know their Part A start date. And so that would be on their card. And so, as Christine mentioned, this used to be their Social Security number, so that can be confusing for beneficiaries who have been in Medicare a while. But even though it's not their Social Security number, it's still a very important number to protect. And so we say protect it like you would a credit card number. And so you prevent by protecting. Detecting. So that is the next part of the S&P model. So we always are telling beneficiaries to keep records, file copies of their bills, make note when they receive things from their insurance. So there's a few different types of notices that beneficiaries would receive. And it's called MSN and EOB. Those are just long acronyms to mean the Medicare summary notice or the explanation of benefits for Medicare Advantage and prescription drug plans. So if you're on original Medicare, you would be seeing a lot more of these MSNs. If you're on an Advantage plan, the EOBs. And these are just detailed accounts of what's happening with your insurance. And so telling beneficiaries to save these and review them for accuracy, review them to see if it makes sense with the care that the beneficiary received. And then finally in the detect is just to ask questions of the provider, the Medicare plan, 1-800-MEDICARE, reminding beneficiaries to call us at SHIP or to call the S&P number if they have any questions about anything that they see in their bills or information. And then finally, report. So if they do detect something when they're looking through all their bills, to call the healthcare provider, call the company that issued the bill, contact S&P, Senior Medicare Patrol, to report that. So this is just an overview of what we talked about with S&P. So one thing to note is we talk a lot about fraud when we're talking about the S&P because the main goal of the S&P is to empower seniors to prevent fraud and to report fraud. And the difference between fraud and abuse is intent. So fraud is intentional. And that is the main difference of when we're talking about fraud. Again, just as review, to review Medicare summary notices, to be aware, and so you could detect or notice any inappropriate billing, such as Medicaid billing, and then again, to treat the Medicare card like a credit card. So that is just a little overview of what the Senior Medicare Patrol S&P program does and its support with SHIP in Tennessee. This is the S&P hotline number. And Lonnie Holloway Hitchcock is the staff of S&P who runs it in Tennessee. So that's just a brief overview. We are going to pause once again for questions. That is the end of the bulk of our content-based part of the training of where we kind of go through all of this information. We're going to pause for questions. We'll take a break, and then we'll talk a little bit more about the plan comparisons and stars and the data entry and that part of the volunteering. So we'll pause for questions now. So we're seeing how would a Medicare beneficiary know beforehand if a care provider accepts Medicare as an insurance plan? You can call the provider and ask if they accept Medicare. It may be on the provider's website, but it depends on if they're original Medicare or an Advantage plan, because if they are on original Medicare, then all you need to ask is, do they accept Medicare? Which is a much broader category. If you're on an Advantage plan, the beneficiary would need to call the provider and ask if they accept that specific plan through the company. So whatever company they are doing the Advantage plan through, do they accept this plan? So it's a little bit of a different process. So asking provider is not required to accept Medicare. Christine, do you want to take this question?
Sure. Yeah, they are not required to accept Medicare. Almost everybody does, particularly in urban settings. It's very rare to find a provider, say in Nashville, that won't accept Medicare. It's a little bit more common in some of the rural areas for, say, a family care physician to maybe not accept Medicare. There is on Medicare.gov, you can see some information about providers. They do have a way of looking some providers. So it gives you an idea, but these things are constantly changing. It's very, very important before you see a provider, if you have a Medicare Advantage plan, to make sure that they accept your specific plan. So you would want to make sure that they have your plan number, because they may accept, as Shay was saying, they may accept something from Blue Cross, but maybe they don't accept your particular Blue Cross Advantage plan. It's very difficult to get this information sometimes because you have to word things carefully. And that's one of the ways that we sometimes help Medicare providers and beneficiaries know how to talk to each other. Because a provider might say, we accept all plans. Well, what they may mean is that they may send in a bill to every plan, but that doesn't necessarily mean that they're on the network for a Medicare Advantage plan. That particularly if somebody is perhaps on a provider where they are have a PPO and they're within like the broader thing, you could say, well, they accept it, but the person may have to pay 70% of the bill. And that's not usually what a beneficiary would think of as having their insurance accepted. This is an excellent question. I want to go backwards just for a second, just because of some oddities, again, of the way we test. We're really trying to drive home the SMP motto, which is important for people to remember, which is the prevent, detect, report. There we go. Thanks, Shay. Prevent, detect, report. So we try to make that very clear. Also, again, this one isn't on our slide. Maybe I should add it. I don't know. Anyway, the fact that yes, you can get a new Medicare number. So you definitely want to protect that number like a credit card, but it is possible to get a new one if it's used for fraud or abuse, if it gets out there. So more questions. Excellent questions, by the way, everybody. Thank you. So applaud wildly if we've done such a great job of presenting that you have no questions. I'm not seeing any.
Okay, so we will take our break now. Oh, we have one question. Yes, what's your question?
Sorry, I was trying to applaud, but also raise my hand instead.
Well, thank you for the wild applause. We'll have a great break then.
So we are going to take a break. We'll take a 15-minute break, so we'll come back here at 10:50.
Oh, I see a question.
And we will answer that question after the break.
Okay.
Welcome back. We'll take a minute for everyone to rejoin.
So anybody have any fun fall activities planned? Now we find out whether we did do a good job, because if we didn't, people may not come back.
Nothing real fun, really, just studying.
Studying is a traditional fall activity.
Especially for pharmacy students.
Yes, definitely. A long, long tradition of pharmacy students studying in the fall. I guess Medicare open enrollment is a fall tradition now.
Yeah, definitely. It has been the whole time I've been in pharmacy, so it's a new fun thing we get to do every year.
Yay!
Okay, before we get to our next part of the training, which is where we look at Plan Finder and our plan comparisons, we have a question. Are there any situations whereby a plan participant would not inquire whether a provider accepts Medicare and files on his or her own instead of a care provider filing on for the participant? Christine, do you want to take this question?
Sure. So it's a good question. It would be a very unusual situation. Very few providers are going to let you get any services without providing some kind of insurance information. And Medicare is not going to let you submit a claim without information given by the medical provider. So it would be an unusual situation. It's much more common, Lily, with say like Medicaid for this to be some kind of a problem. So say if someone has Medicaid and the provider doesn't realize it and they might charge them, then that would be can get very complicated. But most of the time, Medicare is pretty straightforward. They're going to want to know in advance, and they are going to get that information and go ahead and file for you. It might be that if something goes wrong, that you might have to file an appeal. But no matter what the situation, Medicare is going to expect information from the provider. So it would be very rare for a Medicare beneficiary to file on their own.
I was thinking of a situation where a person might just come into a doctor's office. I don't have my information with me, pays by cash. And then when they get home, file. That was kind of what I was thinking of.
Oh, okay. So you were thinking that they would pay up front. That
Yes.
would not be a good thing ever to do, like ever. They would
Oh.
probably never see their money again. So I would
Okay,
not,
thank you.
I would not recommend that.
Yes, okay.
I guess in that situation that they could, as I said, with the assistance of the provider basically is going to have to file something. Medicare is going to have information from the provider. A Medicare beneficiary cannot just go in on their own and say, I received this medical care on such and such a date. I paid for it myself. Here's my receipt, and expect anything to happen whatsoever. The Medicare is not then going to reimburse the Medicare beneficiary for having paid in any case.
Yes.
They might,
Yes.
if the plan, if the provider files, then they might pay the provider, but then the Medicare beneficiary would be left to wrestle back that money from the provider. And as I said, I would just give up all hope of ever seeing it again. I don't mean to sound too cynical, but as somebody who has spent, I don't know, a couple of years trying to get money back, that was definitely my money from these systems. It's usually not a great.
I understand. Thank you.
Thanks. Thank you, Lily. There's also a really good question earlier about turning 65. And this is really important in terms of initial enrollment as to who is entitled to Medicare. So if you turn 65 in the United States and you are a citizen or a permanent resident of the United States, a permanent resident who's been here at least 5 years, you are entitled to your Medicare Part B, and most of the time you can get your Medicare Part A as well. You might have to pay for it. Remember, there's a premium for Part B, but most people do not have to pay the Part A premium. This is a situation where if you haven't been paying into the system, you might have to pay for your Part A, but you should still be able to get it. So it should be pretty much foregone conclusion for most people when they enroll in Medicare through Social Security that they are going to get it.
So we are going to move forward to our plan comparison training. It looks like we have one more question. Original Medicare is defined by just the Part A and Part B of Medicare that is not an Advantage plan, that is just original Medicare. It's just those parts of Medicare. And you might have a standalone Part D or a Medigap plan, like Christine said, but it's just signifying the traditional Medicare route that is not an Advantage plan.
Yeah, the reason for the distinction in the name, original Medicare being A and B, is that the Medicare Advantage plans are relatively recent introduction. I forget when they came in, like maybe 2013, something like that. So they are a new part of Medicare. So that's why we call A and B original Medicare, to distinguish it from people who then choose to enroll in a Medicare Advantage plan. And I'll take this opportunity, as I always do, to re-emphasize the fact that you still have Medicare underneath your Medicare Advantage plan.
Great. So
Thank you.
we are going to go into Plan Finder. This is where we do our plan comparisons on Medicare.gov. We're going to go through that process. But before we do that, I want to show you the worksheet that our beneficiaries received that we will be doing our plan comparisons based off of. So when you go to do a plan comparison in a few weeks, you will be entering the information based off of this worksheet. Can everybody see my screen?
Yes.
Great, thank you. Okay, so this is the worksheet they got in the mail. It has information at the top. When we get to Medicare.gov, there is an opportunity to sign in with a Medicare account. The benefits of using an account when you're doing this process is it may have saved their information from last year. So it may have most of their medications already in the website. And so you would only need to update it or make a few changes. And then it also saves things for the future. So that's the benefit of using an account when we go through the plan comparison process. So if they already have an account, they might put the username and password in it. If you were doing a plan comparison where they had an account, you would enter their username and password, log into the account, and do the plan comparison that way. Some beneficiaries may not have an account or they might not be sure, but they would like one created for them during this process, at which point they'll put their Medicare number, which is that number on the red, white, and blue card, and then their Part A and Part B start date. The Medicare worksheet, or the Part D worksheet, asks some questions. that will be helpful when you're filling out a plan comparison. And so I just wanted to show you all what the questions were so that when we're going through this process, and if you're thinking, how would we know this information? Most of the information you'll be putting into the plan comparison, you'll be able to get from this worksheet. So you'll see if they have a current plan, is it an Advantage plan? You'll be able to see if they have Medicaid or TennCare. You'll be able to see if they're interested in making changes. How would they like to get the comparison? So if they want it mailed, then we'll work on getting the envelopes and addressing them and sending it. Or maybe if they want it via email, we'll talk about how that works. These are questions for screening for extra help and LIS. So we'll always do that. And then this is the actual medication part of the worksheet. It will ask for the preferred pharmacy, which we'll talk about in a minute when we get to the Medicare.gov. And then it goes through the names of the medication, whether they're okay with generic. It looks like. We're going to go to Medicare.gov now. And this is where, since we do have a lot of pharmacy students, it looks like my call quality started to break up for a second, so I'll pause. So this is where having a lot of pharmacy students on this training, if you want to share anything that you know about the prescription process when we're going through the training, feel free to come off mute and share. Okay, so we will go to Medicare.gov now. That is where all of the Plan Finder and plan comparisons happen. So I'm just going to take a moment to share my screen again. Okay. So this is what Medicare.gov looks like. As you can see, it already shows that open enrollment starts October 15th. One thing to keep in mind is that when we're doing plan comparisons, we are doing comparisons for this open enrollment period, which will be looking at 2022 plans. So if you were to go through a plan comparison now, it would automatically show you 2021 plans because it's looking as if maybe you're trying to enroll in a plan now. But when we do the plan comparisons, you want to make sure that it says this is the 2022 estimates because it may be different for 2021. So this is the main part of the website. There are additional resources on the website that can be helpful for beneficiaries, such as finding providers and information, general information about their Medicare card or mailings and so forth. Maybe just some educational information as well. So but we're going to look at the point comparison part. So the first thing is we'll look at what it looks like to log in or create an account. So if you're going through a point comparison and they already have a username and password, you can go ahead and just enter the username and password and log in through their account. If they don't have an account yet and they've indicated on their worksheet that they would like an account created for them, then we go to create an account now. It's just going to have some information about what the website means when it creates accounts. It will need their Medicare number and their start date, which will be right there on the worksheet. I won't be able to go to the next page because I'm not going to enter in any information here, but at the next page, it'll ask for names and some other information that will be on the worksheet as well. Another thing to note, just as I'm explaining this, is that we have a reference guide that we will have during the plan comparison actual event. And so everything that I'm talking about right now will be on a reference guide piece of paper for you to be able to look to, including step-by-step processes for creating an account. So if you do create an account, we have a set username and password that we use when we create an account with Shipt. It's just the first initial last name !1. And so that again will all be on the reference guide if you need to create an account. But we won't do that step today because it won't let me go past this screen. So again, the benefits of creating an account are that it saves information for the future, and they may be able to access other information on Medicare.gov, such as looking at claims or other information about their insurance. However, you can still go through and do a full point comparison without creating an account, and you can get to the exact same endpoint of the comparison. It just doesn't save for the future. And so if you are creating an account, this is the step to do it. If you're going through a point comparison without creating an account, we'll go back to the home page. We will go ahead and look at plans. So if you were going to look for a 2021 plan, you would go here. But if you're going to be doing our point comparison event for open enrollment, let's go to preview 2022 health and drug plans. So now we get to this page. Again, it's going to ask you to create an account again because they want you to be logged in. But if we're going to go without creating an account, you just go continue without logging in. So first, it's going to ask us what type of plan you're looking for. On the worksheet, it will indicate whether they have Part D or an Advantage, whether they're looking for Part D or an Advantage. The good thing about this website is that you can toggle pretty easily between the Part D and Advantage plans when you're looking at a plan. So if you start out looking at Part D and then you need to look at Advantage plans too, you can make that switch without going back and entering everything again. We'll start with Part D. And then zip code, that will be on the worksheet. We'll just use the GNRC office zip code. It's going to ask if the beneficiary receives help with any of these programs. Again, this is significant if they do have extra help, because that extra help will be applied to the cost estimates in the comparison if you indicate that they have extra help. But for the sake of this, we'll just say no. Do you want to see your drug costs when you compare plans? Yes. The answer to this question should always be yes. I don't know really why it's a question on here, because if you're on here looking for a comparison, you want to see the costs. But always check yes to this. And this is where you start to enter your drugs. So I'm just going to enter a few drugs as examples to show you what it looks like for different types of drugs. But again, this is just an example. So I'll start with a drug that I know that this is what the brand name is called. First thing that might pop up is if you enter a brand name of a medication, it's going to let you know that a generic is available. So we'll say it has a lower cost generic version. Would you like to add the generic version instead? That's where you go and reference back to the worksheet. And if it said generic, okay. So if it said generic, yes, then you can click add generic. If it said no, add brand instead. So add the generic in this situation. So the next thing that's going to ask is for dosage, quantity, and frequency. The dosage, you'll be able to pick different dosages. It typically auto populates to the most common dosage for that medication. But you always want to double check that it's the dosage that is correct for the beneficiary on that worksheet. If you get to a situation where the beneficiary does not put the dosage on their worksheet, if you're doing this during a plan comparison event, you can let Christine or I know, and we'll go through the process to call the beneficiary and check. But usually if we don't know the dosage, we want to double check with the beneficiary, because the dosage can impact what the cost estimates will be. Quantity would be how many pills or tablets come in a bottle. And then frequency would be how often are they picking this up at the pharmacy. And so going back to the worksheet usually asks, how often do you take this medication? And then how often do you refill? So how often do you take this medication? If they say once a day and they refill every month, then you know the quantity would be 30 every month. If they take it twice a day and they refill every 90 days, the quantity would be 90 times 2 for twice a day. Frequency would be every 90 days. So we'll say this is once a day. So we'll do 90. every 3 months. Okay, so this is our first drug on the list. The next one that we're gonna do is a tube, because the tubes sometimes end up different, and I always misspell this, so. Another thing to know is if you can't find the medication because either it's misspelled on the worksheet or you're having difficulty, you can browse the drug list and find it that way. And this is where you can see the whole list. Okay. So this is a tube, and so this is just something to keep in mind when you're doing the dosages and quantities and frequency on the point comparison. This is something that comes up sometimes is the worksheet asks, how often do you take this medication? And sometimes you'll find that people will say daily, and then will end up somehow indicating that that they need 30 as a quantity, even though that's they might not want 30 tubes. It's just a daily medication, but the tube will last more than a day, so the quantity would not be 30. So that's something that we see sometimes on these point comparisons, is we just want to double check that the quantity makes sense for the size of the package of what the medication is. And so if it's not correct on the worksheet, we might call, or we might just do the best based off of what it is. But in this situation, if I wasn't sure and I was calling the beneficiary, I would usually ask, if they didn't know what their quantity and frequency was, I would say, how often do you pick this up at the pharmacy? And they might say, well, I only go and pick it up every 2 months and I get one. So you can usually figure it out, but these are the more difficult ones to enter into the system, because if it's not a tablet or a pill, sometimes it can be harder to have an exact quantity frequency, because it might be different months depending on the medication again. So that's where you just want to check with the beneficiary. Again, if this were to come up when you're doing a point comparison at our event, you can ask Christine or I. So for this, we'll just go with that. We'll go with the tube. We'll say 1 every 2 months. Okay. Another situation that comes up a lot is you may have a medication that is not showing up on the worksheet. So maybe they wrote down Zyrtec and maybe they wrote down Zyrtec and it's not showing up. Maybe then the beneficiary also wrote down the generic name. So you try the generic name. And you see this is the first word of the generic name is right. So you go to look at that and you notice that this is a solution. Well, they had indicated that this drug was a tablet, not a solution. So this is not right. So let's go back then, try to figure it out. Okay, so we tried the name brand Zyrtec, we tried the generic name Cetirizine, and it's not showing up. This is a situation where if it is possible to get this medication over the counter, it's not going to show up on the worksheet. So this is a frequent situation, is a beneficiary might write down an over-the-counter medication. That's not going to show up on the Medicare list of drugs, so it won't be able to be part of the comparison. If I'm on the phone talking to a beneficiary explaining this, I will usually say that's not going to be able to be on the point comparison because it's over the counter. But once you get the estimates, just factor in the cost of what that medication is, so that way you can know what your overall cost will be, but it won't show up on our Medicare estimate list. Okay, I'll add a few more just so we can see what things look like. Again, we'll go with the generic version. They'll indicate on the dosage and package, but let's say you get package of 2 every 6 months. Okay, so we'll start with just these drugs so far, and then we'll kind of look at what some different options are. Again, if you have any questions, feel free to put in the chat, raise your hand, or just go off mute and ask it. So if I'm doing this during plan comparison, I'll just read through everything one more time, verify the quantity, frequency, and so forth with the worksheet to make sure everything's correct before I move forward. Now it's going to ask for pharmacies. So you have the option to add up to 5 different pharmacies. Typically on the worksheet, it will say which pharmacies they want to look at. But for the sake of this, we'll try to do like a few of the larger pharmacies and then a few more local pharmacies, but usually look at 3 pharmacies overall. And this is based off of the zip code that I entered at the beginning. So it will show them the zip code of where they live. Some people might go to a pharmacy outside of their zip code. And so at which point you can either check with maybe they put on their worksheet. If they didn't, check what the zip code is that they go to the pharmacy at, and you should be able to find the names of the pharmacies. So we'll go with these 3 pharmacies. We'll also click mail order as an option for the comparison. On the worksheet, it will ask if you would like to see to get through mail order or not. So you'll know whether to check this box. But for the purposes of just showing an example, we will do that. Okay, so this is what the plan comparison will look like. Notice up here in the top left corner, it says you're viewing 2022 plans. So you want to double check that that is what you want to be looking at, and you want to make sure that it doesn't say showing 2021 plans. Okay, so the plans are going to be filtered based off of the lowest drug and premium cost first. That means that the first plan that we're going to see is the lowest cost. We'll look at one in depth to see kind of the information that it's showing. So this is called a Clear Springs Health Premier. This is a newer plan, so it doesn't have a star rating. Most of the other plans will have, oh, looks like none of the star ratings are here because I'm looking at 2022. So the plans will have a star rating. I'll show you 2021 just to show what that looks like. So the plans will have a star rating. The star ratings are based off of quality, performance, customer service, so forth of the plan. And the beneficiaries will get all that information when they get the plan comparison in the mail or an email. Let's go back to 2022 for the sake of this training. Okay, so you'll be able to see the monthly premium. That's the cost that they'll pay a month to have the plan. And then the yearly drug and premium costs. So this is the cost of the premium plus the cost when they go to the pharmacy. You'll be able to see on this front page too that all 3 of the pharmacies are considered in network for this plan, and we'll look at the plan details to look a little bit more. We'll also notice that there is a deductible of $480. Because the yearly total cost is lower than the deductible cost, it really won't factor into what the cost will be, but I'll show you on the next page why that looks like that. Okay, so this is kind of your summary page. This is the estimated retail cost of just the drugs, and then on the left you see the premium cost, so you add that together to look at your total cost for having this plan and what the drugs will cost. So this is again the overview of the premium. You'll see that while all of these pharmacies are in network for this plan, Kroger and mail order are preferred in network, which means that those pharmacies are going to be the lowest cost option. You can see there, because the Kroger is preferred, that the costs are lower compared to Walgreens and community pharmacy. And you can see what the breakdown for each individual medication is and the yearly costs for the medications. Okay, so this is the estimated cost per month for each of these plans. Now notice that not every month is showing up in this estimate, and that's because none of the drugs that I put on the plan comparison were monthly pickups. So I think one of them I'd put a 3-month supply, one of them I'd put picking up every 2 months, and then one of them I'd put picking up every 6 months. So that's why we don't get an estimate for every month, is because they wouldn't be going to the pharmacy every month. So this is only giving the estimates for the months that they would be going to the pharmacy. And you can see that the costs vary each month, and that's because some months they might be picking up all 3, some months they might just be picking up 1 of the prescriptions. And that's just because I put in different months for the frequency of pickup. But a lot of times on the worksheets, you'll see most of them are 90 days or most of them are 30 days. You'll see there'll be more, less variation between the monthly types of pickup, but each person will be different. So you'll see differences on different plan comparisons. So this is what the cost will be each month, just for the retail cost of the drugs. And then you'll also be able to see later what that looks like with again, the premium of $14, $15, something like that. $16.30. Okay. And because you won't meet the deductible in that year, the cost won't change based off of the deductible. We'll look at an example after this where it does. So again, we'll just say you want to look specifically at Kroger because you've narrowed it down, and this would be the beneficiary wants to look specifically at Kroger. They've narrowed it down that that's the lowest cost pharmacy. You can see what the retail costs are and then what their costs will be. You can see that the cost before and after deductible are the same, not going to meet the deductible, which means that really the cost will be the same throughout the whole year. They will not meet the coverage gap on this plan. That's because the costs weren't to the coverage gap level. But you can see what the cost will be. So on the left is the retail cost, on the right would be the cost on the plan. So you can see the difference on having this coverage, what the cost would be. One question that was asked was earlier about why the cost structures were different. And one thing is that plans will differentiate the different medications into different tiers. So preferred generic will be a $1 copay, generic $5 copay, preferred brand, and then is $42. And then in non-preferred and specialty tiers, you start seeing it's not a copay anymore, it's the percentage of the retail cost. And so then you look at the coverage gap, and this is what the costs are in the coverage gap. And then here's where it will say what tier each of those medications are in, so you can understand why the costs are what they are for each of those medications. Here's the drug list again. So this is where the beneficiary can double check that their dosage and quantity are correct. And then the star rating, this one didn't have a star rating, but that's where you would be able to see the star rating as well. And this just goes down to different parts of the page. Okay. I am going to move pretty quickly through this next part, but just keep in mind that we're going to also put out a video before the point comparison where you'll get to review this information, and then we'll also be able to answer any questions the day of the point comparison event. So this is what the different options are. If you're doing it for a worksheet, you would just select the 3 lowest cost options unless they specifically indicate that they want a comparison of a certain plan. So what I would do is I would check the add to compare and then click compare. And then I'm not sure if you'll be able to see me do this step with the shared screen, but you would go to print, and then from print you would click save as a PDF. Or we might be printing them at Lipscomb. We'll talk about that more as we get closer to the event. So we would save them, and we'd save them for our stars entry though, either way. So what you would do, save as a PDF, you would label it, save it to a file, and then you would upload the PDFs to stars, which is our records keeping for SHIP. And so Christine will be talking about that momentarily. But you would save the plan comparison, which looks at all 3 of the plans side by side. And then you would also save each individual plan details, which is that page that we just went through. And I will just show one more thing from here, and that would be adding a drug that would get into the coverage gap, just so you can see what that looks like. Okay, so looks like this plan, the first plan is still the lowest cost option, but the costs were significantly increased with the addition of that plan. That's a biologic medication, so it just added the cost because of the tier that drug is in, but we'll just show what that looks like for the coverage gap. So you can see this would be the cost at the different pharmacies. You can see that this top medication is what increased the costs. I will scroll down so we can look at what it would look like. Okay, so this is where you can kind of see how the costs differ. So first you see that retail cost. The cost before the deductible is that retail cost for this first medication. Then you would see that the cost after the deductible is going to be significantly lower because that's the cost structure that the tier is. The tier is, I believe it's a specialty drug, so then it would become 25% of the retail cost. In the coverage gap, you would see that it's still 25% of the retail cost. So that means that this medication was the same cost because it was still 25%. But that the EpiPen or the epinephrine, what had been $15 actually ended up being $109 in the coverage gap because it was no longer based off of a copay system. It was based off of a percentage of the retail cost, which ended up being 109 of the retail cost of $437. And then this next medication ended up being slightly more. And then the final medication ended up being less because of the percentage of retail costs. So the coverage gap is that 25%. And that's what the cost can look different throughout the year, depending on your overall cost and the retail cost of the medication and what that means for the percentage of that. Again, I'm moving pretty quickly through this, but we'll be able to talk more in detail about this as questions arise at the event, the plan comparison event. And then you would be able to see that the monthly cost would vary because the first month would be that before the deductible is met, and then the subsequent months would be after that. The last thing that I'm going to show before we move to STARS data entry is what it looks like for an Advantage plan. So right now we're in the PDP plans, and you can tell that because it will say PDP. If I wanted to look at Advantage plans, I could just go view Advantage plans. The Advantage plans will look differently because they will say PPO or HMO on the plan. With the Advantage plans, you see more information because remember that the Advantage plans are bundled plans that include Part A, Part D, and for many of them, Part D. Part A, Part B, and for many of them, Part D. And so what that means is it's going to show you a lot more information, such as co-pays for primary care visits, co-pays for specialist visits. But we'll look at this first. So this is the Blue Vantage Garnet PPO. PPOs compared to HMOs have a little bit more flexibility to go out of network, but it will still be more expensive to go out of network. PPOs say you can go out of network, but it will cost you more. This plan does not have a premium to have the plan, which means that for beneficiary on this plan, they are only paying the $148.50 of the Part B premium if they have premium free Part A. So they do not have an additional premium for having this plan. You see the drug cost here, and then you'll see that there is no health deductible and there is no drug deductible for this plan. Here you'll see the maximum, so this would be the maximum you pay for health services. So you would see the in-network amount, and because it's a PPO, they also have a second maximum for in and out of network. As we mentioned earlier about Advantage plans, they sometimes have additional benefits such as vision, dental, and hearing, and sometimes fitness and so forth. You'll be able to see all of that on the plan comparison as well. I won't talk through the plan details, but you'll be able to see that it has a lot of information because it has all of the different copays for different types of care and hospital services and so forth. And then it also goes through that drug information. And this part of the plan details will look similar to what it looks like on the PDPs or the Part D plans. And it will just be based off of this plan's cost structures and tiers of the medications and so forth. Okay. And then similarly to the Part D plans, to create a plan comparison, you would just click Add to Compare for the 3 lowest cost options, unless they've indicated otherwise. And you would go to Compare, print the comparison, save the file for the side-by-side comparison, and then for each of the 3 plans, you would save the plan details page as well. So when we're talking about learning about how plan comparisons work, this is kind of your first look at all of this information. And remember, there will be other times to review this information before you complete the plan comparisons. So that was a lot of information. So let's pause for a moment and see if there's any questions.
I have a question, may I ask?
Yes.
I assume the enrollee can access this plan comparison tool online by themselves?
Yes,
without
great
the help
question.
of a.
Yes, so for the plan finder, which is the Part D plan comparisons and the Advantage plan comparisons, the beneficiaries can look at all of this information as well. So they can go to Medicare.gov and go through this process and create an account and do a plan comparison. We at SHIP assist people who ask for our assistance in doing this process, but yes, they can go on the website as well.
And am I right to understand that the primary purpose of this tool is to let the plan enrollee know how much they are responsible for payment as opposed to the total cost of the drug?
Yeah, so this tool compares the cost of the different plans that are available to them in their area, and shows them what the lowest cost options are for out-of-pocket costs.
Oh, I
And
see. Yeah.
yeah, and so because with all drug plans, it's through a private health insurance company, whether it be through a Part D, PDP, or whether it be through an Advantage plan. So this tool can basically do side-by-side comparisons of these different companies and different costs to see what the options are.
Thank you. If a beneficiary chooses not to create an account, can they still save what they filled out on a PDF and save it on their own?
Yeah, great question. So they can still save what they completed on a PDF, like what we were just talking about. What we'll be doing during the plan comparison is we'll be saving the PDFs and either mailing or emailing the PDFs to the beneficiaries. The key difference with saving is that if they wanted to go back to the website on a different day, it would not be saved. So if they wanted to go back in a week and look at it again, or if they wanted to go back and enroll in a few weeks or so forth, they would need to enter the medications again.
Thank you.
Are there any other questions? Okay, so with that, I will pass it over to Christine, and she's going to talk about STARS, which is our data entry system.
Hi, everybody. So this is a lot, and we do realize it, and we do want you to know that you are not responsible for memorizing this information. The first part that we did before the break, that's the part that you're going to be tested on. Again, it's going to be open book. This second part is what you're actually going to be doing when you're doing the plan comparisons and entering the information that you've gotten in STARS. So again, we will be there to assist, and again, there will be a reference sheet. So I just want to emphasize that because I so much appreciate all of you being here, and I don't want you to feel like you're on your own with all of this vast amount of information that we've given you. And it is very exciting always that so many of you have come from different backgrounds and have different strengths, because we do find that sometimes you can help each other as well. And I wanted to tell you that you can actually help each other on today's test. Shay and I cannot give you answers, but your fellow colleagues who are taking the tests alongside you can. However, do be careful, make sure that they know what they're talking about. So back to what we're doing here, and I'll need to share my screen. When we are doing these comparisons, it's very important that you do go ahead and save them as you're doing them, as Shay was showing you how to do, because we not only have to send it to them, we also have to keep a record that we did this plan comparison for them. So since we're doing a plan comparison, we're not going to be enrolling anybody, but we are going to be giving them this comparison. We want to say that. So I will do a STARS example as if, up to a point, as if I were saving something. What I really should have done was I should have done a Medicare.gov already and saved that someplace where I could access it, but I didn't. So sorry about that. But I think it will be pretty obvious once you see some of this. So the STARS program is run by the Administration on Community Living. You are going to be getting your own on that. So you'll have your own little account. And what we're going to do now is go into mine. I am trying to get it to share. Come on. And I'm not. There we go. Come on, hide share options. It shows it and then it doesn't show. Okay, there we go. Windows. There we are. So is everybody seeing the ACL screen? It has IntelliTrack at the top.
Yes.
Thank you, Shay. Okay, so when you are doing this for real, you will be able to sign on to STARS through this. And it's a little weird that it's called ACL, but since you all know that that is for administration for community living, it shouldn't be too confusing. For some reason, I always find it confusing. Once you sign on, what you want to do is create a beneficiary contact. So you're going to have that sheet in front of you with their information, and that's going to give you everything you need. you will go to the tracking inbox, you will go to beneficiary contact, and you will do new beneficiary contact. This will give you a blank contact form. MIPA, which you are being trained in, has to do with whether or not they are going to be getting one of these Medicare programs that assists with costs. So if they make less than that 150% of the federal poverty level, then they will be entitled to MIPA. But whether they make that or not, and this is a little bit confusing, we do check yes, so long as they've given us information about their income and assets. So if they've given us information about their income and assets on that form, which has a place for it, and they should have done so, even if they're above the 150%, we do go ahead and check yes, because what they're concerned with is that we make sure that we ask about it for everyone who comes through, if at all possible, and that we don't miss out on helping anybody who might need that help. I wouldn't expect on Send to SMP that any of you would be saying yes. SMP is only if there's some sort of fraud or abuse situation. So unless there's some sort of little handwritten thing on the sheet saying somebody signed me up when I didn't want to be signed up on a plan, unless there's something very odd, in which case I do recommend asking Shay or myself about it. You're just going to leave that be. It's already checked no, and you'll just leave it there. The SERS e-file ID is already done. You don't have to mess with that at all. It's a way of keeping track of it in the system. This one automatically populates with my name. Yours should go ahead and automatically populate with your name. Now, the affiliation, you're always going to be using the 37228 for these plan comparisons. You're doing it with the GNRC office, and that is our zip code. So that once you've done that, it should then pre-populate the Davidson County for you. It's important to remember to do all of this stuff at the top. Then you just go through your sheet with all of the information from the beneficiary that you're assisting, and you just put in their information. This box, for some reason, I used to find a little bit tricky. You always need to make sure that you go all the way to the left on it to start. That's just, I would call it a pro tip, except I feel so stupid for the amount of time that it took me to figure that out. And I'm sure that most people just automatically go all the way to the left. But you make sure you go all the way to the left, because otherwise it has this little odd formatting thing. Email. Representative first name, again, with plan comparisons, you're probably not going to have to worry about this. Plan comparisons are usually sent in by the beneficiary. If it's not sent in by the beneficiary, that's where you would put something in. So say I was doing it for my mother, then I would put her name as the beneficiary, but I would be the representative. So if somebody sends it in on behalf of a relative, you might see that. I really wouldn't expect it though. We're sending out these in mailings that are usually to the beneficiary themselves. So mostly when we receive back requests for plan comparisons, we are receiving back requests from the beneficiaries. Then again, it's very important to just note the zip code. If somebody has moved and they mentioned that they've moved, you might want to check to make sure. You might want to ask Shay or myself, is their county still one of the 13 counties that we assist? We can still do the plan comparison for them, but we might want to set it aside and send it to the appropriate county. I mean, I'm trying to go through them as they come in, but I'm not going through all of them, so it's possible. I've only had one so far where they moved to a different county. Then here, the date of contact. You're just going to go ahead and use the date that you do the plan comparison. Date of initial creation, that's going to just automatically populate is when you put it in there. If you wind up, for instance, maybe you get a little behind during the event and you need to go back, so that might change this, but I really would recommend, if at all possible, to get everything done the day of, because it will just be easier for you to keep track of it. How did they learn about SHIP? You can just put previous contact on all of these because we mailed a letter to them and asked them if they wanted us to do it for them. Then this one will depend on whether you're sending it back by postal mail, which you probably are, or if you're doing it by email. So you just choose the appropriate one. On the age group, again, you just go back to that sheet that they have. They're just looking for the age group. You don't have to have the exact date, but since it has their date of birth, male, female, it's okay in this situation to go ahead and just base it on the name. We are dealing with an older population. So unless somebody specifies that they want a different gender, then we would just go based on the name. If it's a name that's not clear to you, you can put not collected. Race, we're going to do not collected, because we're not going to know just by their name on the form. English is a primary language. Most of the time you're going to be doing yes. If there is evidence that it's not a primary language, for instance, there's something where there's a phrasing that makes it very clear that this is not their first language, then you can do no. But I would say that in almost every case, it's going to be yes. Monthly income, remember, it's going to be on there. So you're going to know whether it's above or below the income and assets limits. This is a very important one for our performance measures. If they are under the age of 65, and I'm not talking about a 64-year-old who's applying for Medicare, which should not come up in this case because these are our annual enrollment people looking for plan comparisons. So if they're under the age of 65 and they have Medicare, you're going to put yes. And notice how this contradicts what I did before, and it lets me know. It says, wait a second, they have to be 64 or younger to apply for this option. I'm like, oh yeah, that's right. They're not that age. So if they're over 60, if they're 65 or older, it's going to be no. But if they are 64 or younger, it's going to be yes. In terms of the topic selected, you're going to be checking off the eligibilities here just because they are. We know from them sending it in, we know what their eligibility is. You're not doing a benefit explanation of Medicare, so you won't check that. But you can just go down the line and do eligibility. Eligibility. When you get to this third topic box, this is the most important topic box for this particular plan comparison event, because plan comparisons, you are either doing a Medicare Advantage plan comparison or you are doing a Medicare Part D plan comparison. So these two boxes here are the ones where you're going to be doing your plan comparison checking off. So notice that on this one, plan comparison is right down there, but you do have to scroll down to get to it. And this one, eligibility screening. And again, you have to scroll down if it's going to be a plan comparison. Usually you're going to be doing one or the other, but there may be some people who want both. So let's say in this case, there's somebody who wants both. Part D, this is important because we are checking to find out whether or not they're eligible by taking a look at what the worksheet they sent in. Medicaid, similarly, though, if you don't check that one, it's really not a big deal, but we can say yes, because they're going to indicate that. Then these other ones you can just ignore. Time spent in minutes, this is the total time that you spent, as Rebecca said. However much time you wind up spending, just put it in. That includes all the time you spent. Depending on how quickly you do that, it may be, usually it probably would be like 20 or 30 minutes. It might be less as you get used to it. Status is going to be completed. Okay, then we get into some very important fields. When you are doing these comparisons, one of the things that you need to note, based on the pharmacy that they are going to go to and the drugs that they are taking and the plan that they had before, you need to put down the original cost of their drugs and premiums. And that means, what would it have cost if they stayed on their current plan? Well, let's say it would have cost $410. Then you also need to put underneath that how much it's going to cost on this new plan. And remember to compare apples to apples. So you want to make sure that you're doing it same pharmacy, same plan, same pharmacy. But this, but now I'm confusing you for no reason, because you are not going to be enrolling them, so you don't have to worry about it. If you do the next step after doing the plan comparison, and you are actually speaking with people and counseling them, and you're going to any of the enrollment events that you're doing, you might have to do that. But I'm not going to go into that anymore because I'm just confusing you for no reason on that one. Notes, you probably don't need to put much here. If there's something unusual about it, you might want to go ahead and say so. I'm trying to think of something interesting. The only thing I can think of off the top of my head is if they were new to Medicare in January. Or maybe we were talking about moves earlier. Maybe they've moved to a new place, but even that, you might want to put that in. But it's not essential. So here's the most important part of what you were doing, because most of this other stuff we can perhaps reconstruct, but what we can't reconstruct without knowing it is what plans you actually found for them. Well, we can, but it would take a long time. So what you're going to do is, since you've saved your plans for them by name, we hope on the computer, you go ahead and at this point you do browse. And let's see. I don't think I have anything that I can attach as a real plan, but you would attach I'll just go ahead and pretend that this is a real plan. You would go ahead and click on the plan, and that would include the comparison of the 3 plans that you did for them, and then details for each of the 3 plans. If you did both Medicare and Part D plans, then you would have to go ahead and combine them or do a separate contact form, because you see that you're not going to have a different enough spaces for both Medicare comparison for Part D plan for 1, 2, 3, 4, and then also a Medicare Advantage plan comparison of 3 and then 1. So you'd have to combine them. And then once you've attached all of them, so you've done the comparison of the 3 plans, and you've done the details of each plan, then you can go ahead and save. And if it did have any problems with what you put in, if you left out a field or something like that, it will let you know. Now, the weirdest thing about STARS to me is that after you've saved it successfully, you just see the same page again. So how do you know if you've successfully saved it on STARS? It's just this little line here, the ship reference number. Notice that right now it's blank. If you've saved successfully, then that will have a ship reference number. And that's really the only way to tell. So I hope that most of that seems like it's fairly straightforward. If you want to go ahead and ask questions about it now, that'd be great. Okay, so it looks like most people are feeling reasonably confident about that. Remember that you can always email us, you can phone us. If you do have questions that you want to try to get answered before we next meet in person. I'm just putting myself in the chat there. Okay, you guys are amazing. Question regarding a previous part of the presentation. Okay, well, before we go on to that, I would like to just once again ask about STARS. If anybody has anything that they want to talk about, does everybody feel confident? If you feel confident, do a thumbs up for me if you can. Go over to that little face with the hand holding and go to the far left. Oh, I see a thumbs up. That's awesome. Any other thumbs ups? Okay, so I'm confused. I should be seeing something. You can click on whatever you can. If you can't find the thumbs up, but you can find something else to click on. Okay. Okay, there I see it. There we go. Okay, good. Good. Okay. Excellent. Yay, thank you. And thank you for talking in the chat. Okay. I'm going to so I'm assuming that those hands up were this is good. But I will be quiet for a moment just in case they weren't. Yes, absolutely, Lily, I totally understand that. So both STARS and using the plan comparisons on Medicare.gov, it's not something that you can just see and then say, okay, I'm great at this now. It is something that you do need to have some experience using. So I totally understand that once you're hands-on. And the nice thing is that you can today go to medicare.gov and play around in there if you want to. And you will soon have access to STARS as well. So I will go back to Lily's question. Okay, so Lily, you're asking about a time period in terms of, that sort of gets beyond what we deal with as SHIP counselors. So we are primarily here to provide information about how the beneficiaries use Medicare. We really, and you had asked earlier about whether providers reach out to us for Medicare information.
Yes.
They do fairly rarely, partly because, yeah, this would be the type of question that they would want to know. How long is it going to take for Medicare to pay a provider? And that's something that we can help them look up, or we can look it up ourselves. There is certainly a fairly long time period that Medicare gives itself for paying a provider, but it's not really the sort of information that we provide. We are here to primarily help beneficiaries. Now, that may sometimes mean helping providers as well, but it's usually helping the providers understand how to serve beneficiaries. It's not helping the providers deal with Medicare directly themselves. It's helping them make sure that they're following the rules set down to help the beneficiaries.
Got it. Thank you.
So that's great. You guys have been doing wonderfully well today. Thank you so much for all of the questions and all of the listening to all of this stuff. And I see that Rebecca is back with us. I'm going to be quiet and let Shay chime in, and then maybe Rebecca.
If you have any other questions, again, you can put them in the chat. We will start to move towards the final part of our agenda today, which is taking the level 2 test. Again, this is just a certification test to be SHIP volunteer trained. It is open note, open book. You can use the PowerPoint. We'll put it back up here in a moment. You can use the internet. You can talk to each other. You just can't talk to Christine or Rebecca or myself. But the way that I like to phrase the test is that when I first heard about taking the test and having it be fully open note, I was slightly confused. But when you are doing Medicare counseling or you are a SHIP volunteer, you are using all of your resources that you can when you're counseling. If I'm on a counseling call and somebody asks a question that I don't know the answer to, I'll just quickly Google it so that I verified that I have all the information. If you have a question, you can ask another volunteer, so forth. And so having this test be fully open book or open note is really how we as SHIP counselors go through that process. Is we're always looking for the information to verify that we have it correct. So you can use your resources when we're taking the test. It's also if you don't pass, it is totally okay. You can take the test again. There are multiple opportunities to take the test, so don't worry too much about that. But we will move into that shortly. And just before we do, I'll just see if Rebecca has any closing thoughts today.
Yeah, hey everybody. I just wanted to add that I will be adding you to STARS after you've passed your test, because I'll need to have everybody pass it to be able to give you access. And when I enter you in there, you will receive 2 emails, and they should come from Booz Allen, which is the company that does STARS. And one will help you tell you what your username is, and then the other one will give you instructions on how to set your password and get in. So once you have that, you can kind of look around and and make sure you're comfortable with entering things in there. And then, yeah, as Shay said, use all the resources to take the test. We can put the PowerPoint back up here so you can kind of click through as you're taking it as well. And you are welcome to talk to each other too. You can't ask us questions during the testing period, but you can talk to each other. So if you don't remember something or need someone else tell you what slide to look on, you can help each other. So we can stay on while you're taking the test, so you have that opportunity to talk to each other. And then kind of for next steps after you've passed the test, we will send you a recording of just like kind of a short summary of any changes that might happen to the playing comparison tool while we are doing open enrollment. Usually in the beginning there might be some little changes that haven't been apparent just yet, and so we want to make sure that we can capture that for you and do just a quick review. So we'll send you like a short, probably like a 20-30 minute recording that you can review prior to those workshop days, just so everything is fresh in your mind again. I think that's all I wanted to add.
Great. And we just got another question in the chat. If a beneficiary asks a question for which we can't find an answer, can we tell them that we'll get back to them after speaking to one of our colleagues? Yes, absolutely. That is a great practice to do. And that is something that I still do if there's something that I know I won't be able to find the answer to immediately. So yes, absolutely. If you're counseling and you don't know the answer, you can say that you'll get back to them after you find it. So the PowerPoint is back up on the screen. Here is our contact information. If you have any questions or concerns, you can email us. Again, just like when we were doing the presentation material, you can flip through the slides while you are taking the test. And we will go ahead and put the link to the test in the chat, and then you all can go ahead and get started.